Hello, I'm Robert, and I just read out the WHO statement that we can still contain it, even at 100,000. And as Dr. Tedros said, it's a sobering moment. We can still be contained and the spread's slowed, and facts and evidence support this. And 80% of that is all in China, where it is being contained and slowed and even reversed. So I'm going to talk a little bit about that. So if you come and look here on the map, it certainly looks quite alarming. You look at Europe, and you see there's Italy, which we now has 5,000 confirmed cases. And now we're getting very large numbers in Germany. We've got 800. In France, we've got 949. And in the United Kingdom, where I live, we've got 209. So that might seem very alarming. But a lot of that is really just the Italian outbreak. So to explain a little bit about what's happening there, and just basic kind of mass kind of thing, so the whole of Italy. So what's happened? This Italian outbreak is it was completely uncontained to start with, and when it's uncontained, they didn't even know it was there for 2 weeks, and it doubles every 3 days or so. And so it very quickly gets up into large numbers until they found it. And we know there are not lots of outbreaks like that around the world, because there are quite a few places like Singapore where they test everyone. And in those cases, we know there's no way outside of their 100 and something cases that they're following in their clusters. So, but Italy, then they had this case that they didn't know that he had any contact from outside, so they just weren't checking him. And then he went into a doctor's, infected the doctors and the other patients, and he'd also been had a fellow runner, and they were running together as a team, and they infected each other, and with one thing or another, it spread out throughout Italy. So now the thing is, because it spread so far before they knew what was going on, then that meant that there were lots of people who just thought they got a cold or a flu or something, no idea they got Covid-19. And then they passed on to someone else, who passed on to someone else. And so this means there are quite a lot of people in Italy who are infected who are not yet showing symptoms, because it can be up to 2 weeks before you get the symptoms. And then a lot of these people, Italians, it seems it's quite a hub where lots of people travel to and from. So a lot of people got infected there, and they've ended up in other countries. So all these big blobs, an awful lot of them are to do with Italy. And what happened there, it seems quite alarming, especially if you're in the UK, say, or one of these other countries, you get it doubling every day. It seems to be doubling. You might think, well, at that rate, soon everyone will have it. But what you've got here really is percolation. So you've got an outbreak that continued here for about 2 weeks. And since you've got a certain amount, you've got a very large number with it. And then being a lot of mobility between there and somewhere else, then the outbreak is spreading outwards to other countries. And so if it's percolating from somewhere else, it can increase very quickly just because the kind of wave of that percolation is passing over your country. And it doesn't mean it's increasing in your country, it doesn't mean it's increasing hugely in Italy, because another 2,000 cases there is not an awful lot compared with the 5,000 in Italy. So if you think of all of this as being part of the Italian outbreak, it's not nearly as alarming as it seems. And we can contain, so really it's 5,000, 6,000, 7,000, you have many there. So, I mean, it's quite a lot. Not doubting, maybe 8,000, 9,000 or more, quite a lot in one big outbreak. But we can contain it. And China's shown you contain it at far more than that. And we have the example of South Korea, and Iran is containing theirs, and the WHO is saying all these places are containing it. They're doing a good job. And so they're on their way to containing it. It's not in control, but it's not uncontrollable either. It can be controlled, can be stopped. So I'm just going to have a little go around the world. Look first of all at South Korea. If you look at South Korea, they've got the largest amount in a single place outside China. They've got 7,000. Now, if you look at the map for Italy, you can see, now if it was increasing exponentially, if it was a real outbreak, it'd be going like that. And you'd have, Chris knows where it would be by now, probably tens of thousands, maybe even more. And instead of going like that, like it would do if it's a proper outbreak, then it's definitely levelling off. There's no doubt at all that they're controlling it. It's coming under control in South Korea, absolutely no doubt about it. And the WHO say that these are all traced back to a few clusters with very little community spreading. So even with 7,000 cases, most of those 7,000 cases could be traced back one person to another through very close contacts or prolonged contacts, including religious meetings, of course, going way back to there. And that's why it's possible to contact trace, because it's done like that. These are not people, you don't get it from your taxi driver, you don't get it from someone you pass in the street, or if you're sitting in a bus stop with someone else, you won't get it from them. Very, very rare for that to happen. Or as a child at school, or in the underground, or in a plane. We've had many people who have flown back from Wuhan sitting next to someone who was infected, not even knowing it. And they didn't get it either. I'm talking about way back before they even knew that it could be passed from human to human. Back in January. Still, it just wasn't happening, even though nobody was taking any precautions. So it is not easy to spread. It's not like flu. It's really quite hard to spread. And in a family setting, then only 1 in 10 of people living in the same family, in the same house with someone, then only 1 in 10 gets infected. So it's not easy to get it. But because we are so very, very sociable as a creature, then it's easy, just one person out of maybe 10 people, one person will infect 20 that they're very, very sociable with. And because they just happen to be, maybe they shed the virus more or something, and one way or another, then that's how it works. For an awful lot of people, you could have someone in your house who's positive with Covid-19, and nobody else gets it. And that's happening over and over. That's why it can be stopped. Now, so if we go now to China, and China is where it's really dramatically shown that it can be stopped. Very, very dramatic. So I'm going to show what's happened with this other app, which is, so this is Henan province. It's the very next door province to Wuhan. Went up to over 1,000 cases, but look at this, 1,231 cases on the 16th of February. There was one extra case in March, beginning of March, and it stayed at 1,272, only 2 extra cases. And if you click around, so it's obvious that they've contained that. And to bear in mind, they don't do it by locking the city down. Only in Wuhan have they locked it down. These other places, they're not locking it down at all. They're using this contact tracing, they're reducing numbers of gatherings and things like that. And I don't know which provinces they are, sadly, but I mean, if you just click around, but 11 of the provinces have gone right down to their lowest level of green. It's the same pattern for all of them. Look, you see, increasing, it just levels off, like that. For 576. It's the same pattern of 576 back in the end of February. You just click around anywhere in China, and you just get that same thing. And you look at the numbers there, 18. You can also look at the numbers if I just left it over, 18. So, and even in Hubei province, you've now got 45,000 recovered, and only 19,000 currently sick. And the number per day is really going down in Wuhan as well. Let's click on Wuhan. Look at that. Hubei province, however you pronounce it. Look how it's going up like exponentially. It's not just levelling off. And you're not a very big increase. Look, 67,000, it's taken a long time to increase from 67,000. Several days to it's still 67,700. But here, that was just a data change. But here you can see it's increasing much faster. So they did with lockdown, but other parts of China, then they didn't do that at all. They did very much like we are all doing in the rest of the world, because they knew what they were facing. And all the cases outside of Hubei are much less than now in Hubei, although of course the population of China outside Hubei is much larger. And this just would not happen if this was an influenza outbreak. And we had this international team, it's been all the way around China, and they verify on the ground, and these things are happening just as they say in the figures, what they see on the ground, the hospitals with empty beds, the fever clinics with the CT scanners just running idle because they haven't got enough patients anymore to be using them all the time, and the clinical trials where people are not finding nearly as many patients, and so the clinical trials are taking longer than they originally expected because they're just not getting the patients that are so sick as they used to be. So that it's been contained in China. It's very close to containment, to the extent that the very few cases now of human to human within China, and they're more concerned now about cases from the rest of the world in China than they are about their own cases. Very few cases in China, and mainly it's other countries they're worried about. And China is, because of this very, very quick action that they did, very decisive action, then they're like the first line of defense against Covid-19. Now we are the second line of defense. So you've got Iran, and now it's very, very important what's happening there. So Iran, it doesn't look as if it's got so many. This is a rather funny graph. It's just that it's the only website I've found where you actually get these graphs you just click on and see so easily. They obviously have a funny curve fitting thing. We have a point there and a point there, and just something goes down. It just piecewise polynomial fitting. I know exactly what's going on there, and whoever wrote this app shouldn't have used that method of interpolation. But they're using the right data. They're just using piecewise polynomials, probably cubic splines, and it's just not the right thing to get an accurate looking curve for this. But apart from that, it's excellent, and so, it gives the same figures as everyone else, and it shows you how the figures work. So you can see Iran's increasing, and but it's very good that it's actually good news that Iran is finding so many cases. They must have many more. They think well, maybe 7,000 or more. Who knows? They've got so many tests there, and they have got excellent healthcare, so they must have lots of cases to find. So the good news about Iran is got a Chinese team in it, and I think we should all be getting in Chinese teams. Not that we're going to do it the way China did, but we need to learn the lessons that China's learned and apply them in our health systems. And we should be getting people from China and obviously people who haven't got Covid-19 to come over and advise us and tell us what they've learned. And there's quite a lot of that going on via video conference. Anyway, Iran has got Chinese people on the ground, and they've got the WHO on the ground. They've got 100,000 workers working to contain Covid-19, and so they're taking it very seriously. And they've got a good healthcare system. You mightn't realise, because you might think with all the sanctions of their poor country, they've got a low GDP, but they've got a very, very high quality health system, to the extent that you have health tourism from India and Europe. And they've got excellent healthcare facilities. They can stop it. Italy, of course, has got excellent healthcare systems, and they can stop it. And they are doing lockdowns and all the contact tracing and quarantining, and so they if you look at their figures, they look as if they're just increasing up and up, but they're not increasing really exponentially. The main thing is that they're finding the cases, And it's really excellent news that all these cases are being found. 1,000 cases there. That means that they're acting very promptly and discovering them quickly. And one of the keys to China slowing it down was, instead of it taking 14 days, as it did in the very beginning of the outbreak, before people end up in hospital, and then they were on to the serious phase, and then they died. Sadly, about 17% of them died in the very early stage in Wuhan. But then now in China, it's 3 days from onset of symptoms to being diagnosed with Covid-19, getting your test, and then being in hospital. And then if you get treatment very early like that, it also improves your prognosis, and it can stop you from going so serious. And if you do get serious, then you've got more time to work on it. So that's part of the key. But it's also finding people so quickly, only 3 days in, means that before they had all 14 days before the very serious symptoms, that's not after infection, that's after onset of symptoms. They had up to 2 weeks after onset of symptoms before they said, "Oh, I feel awful, oh, I can't breathe, I've got to go to the hospital." Then they end up in the hospital, and then sadly then maybe it's quite difficult to keep them alive. But also, during all that 2 weeks, they were infecting other people. And that's why it grew so quickly in Wuhan. And so if you can find everybody quickly, then even if they've been seeing other people in between, and even if they didn't know they had Covid-19, just finding them quickly will slow it down a lot. And so it's not like flu, it's got quite a low R number. They say between 1 and a bit above 1 and a bit above 2 or so. And this is the number of, like if you've got 10 people, they'll infect 20. Now, in that situation, suppose you've got 10 and they infect 20, they infect 40, they infect 80, and and then a couple of weeks later you got into 100 or so. So suppose you've now got 100, they're going to infect 200 if you don't do anything. Now, suppose you find just 3/4 of the people they're going to infect. And those 100 people only infect 50. And then if you can catch those 50 quickly within 3 days, and they only infect 1/4 of the people that they would normally infect, then instead of those 50 infecting 100, they'll infect 25. Then those 25, they'll infect 6 or 7, and then they'll infect just 1 or 2, and then it's over. So that's why you don't have to find everyone. So people get all hung up on this, and they say, "Oh, it's impossible. How can we find every single case?" You don't have to. You just have to find 3/4 or so, and you'll stop it very quickly. Even if 1/4 of the cases slip through the net, if it's got an R factor of 2 or so, then you're going to stop it very quickly. And then also add to that, we've got everybody now washing their hands, keeping their not touching their face with their fingers, especially not with unwashed fingers after touching a public surface. And this also must be reducing the R naught number, even for people who haven't got COVID, who don't know that they're sick. And then also not coughing in your sleeve, like they say for WHO, or using a tissue and bringing in a closed bin. If everyone does that, even if they don't know this. And one of the interesting things there, I've been wondering, this must be reducing the spread of flu and colds as well. I wonder if it'll reduce the flu deaths, and more people doing this. But anyway, so with all this going on, there's no doubt that we have definitely reduced the R naught number. And then if we can also get people into hospital, maybe it's not reduced to less than 1, but it's reduced it a fair bit. Now if we can also get people to be diagnosed within 2 or 3 days, then of course it's very sad if they've infected anyone, but in terms of stopping the epidemic, then if we can get them diagnosed and quarantined within 3 days, then R naught number is going to go way down, and it's just going to stop. That's the way the maths works. So I just look at these people, I think they don't understand maths. I mean, I suppose maths seems so obvious to me because I've been a mathematician, I trained as a mathematician. I sometimes find it difficult to understand why people don't understand the maths behind this. But this very idea, and some even very distinguished professors, but they just don't seem to quite see it in this mathematical way. It seems so simple. So so the epidemiologist, of course, I'm doing this based on, it's not my idea. I'm basing this on what they discovered in China with that big 9-day fact-change seeking mission. But then they seem to be these very conservative, stuck in the rut epidemiologists around the world who just say, nah, that's impossible, it can't be. We all know that flu can't be stopped. And I think and then I just looked at it, but it's right, you can see the numbers, you can see the maths. For me, the numbers are absolutely prior, the numbers are the thing, and the facts. And, the actual data, numbers in terms of data, and then the explanation makes sense. If you can reduce the R0 number below 1, it's just going to stop. And you can go on and on about but it's not flu. Flu has got a very high R0 number, and that flu also has lots of asymptomatic spreaders. And so it's much more harder to do, and probably impossible to do this with flu. But with flu, you would be able to give it to your taxi driver, or something like that. It's much more infectious. So that's why this is so different, and we can stop it. And don't worry, it doesn't matter if you've got 1,000 people. It doesn't even matter even if we had 10,000 people in the United Kingdom. If suppose we got 10,000 people in the United Kingdom, a few hundred in each county. 100. I don't know how I can't remember how counties we've got. There'd be less than 100 in each county. It's not that much. And then suppose we put out surveillance across the entire country, and we managed to find everyone's got Covid-19. We just need to find 3/4 of them. So 3/4 of the people with Covid-19, we find them within 3 days. Then it's eventually going to stop. Just mathematically follows. And that's what's going to happen. So hopefully we're not going to get anything like those numbers. And if you get the numbers go up quickly in your country, and if it's the result of people doing like a study covering like in the United States, they're going to have 1 million tests of people in the United States, testing people with symptoms to see if they've got Covid-19 all across the United States. They hope to do that next week or two. So now if that turns up, it may, from the experience of the rest of the world, it mightn't turn up much at all. It might turn up there's only maybe another 100 people that have been missed. Or maybe it turns up 1,000. If it turns up 1,000, don't get alarmed. It's tiny compared with the entire population of the United States. And all those people, they turn up immediately quarantined, and all their contacts go into isolation. And then if they can then get their contacts as soon as they get symptoms, then they treat them and so on. If they can do that, then it doesn't matter how many you've got. Then if you reduce the R0 number even to a quarter of what it was before, then just very, very quickly, within weeks, they'll all be gone. There won't be any new cases. Just the way the maths works. So now let's go back to this map. This is the official one. So this is the John Hopkins one. I'm sure they've done a good job of it. And this is some app I don't know what their credentials are, but they do a good. But they're good for those graphs. And then the data is all public and easily accessible. So I'm sure they've done it right. But I tend to start on this one because it's the by university, and so anyway, if you go and look at that. So what was I saying? So China is the first line of defence. Now we see, and Asia generally, and Hong Kong, and then there was Singapore, and Singapore is one of those really contained it as well. How's Singapore doing? $138. It's just not great. And for 78, only 60 active. And so yes, Singapore is still doing very well. It's creeping up. You expect that all in a few clusters, and so it's so China. So the Asia was the first line of defence. Of course, there are now big problems in Japan. The South Korea is part of the Asia one, and they're containing it. It's at 7,000, and Japan, they're going to be acting very vigorously to contain theirs. And then, so they're the first line of defence. Now we've got Iran and Italy. I would say the second line of defence, and they are still rising uncontrolled. They were uncontrolled until quite recently. Now they're being controlled, and they should level off like South Korea did. Probably the end of next week, beginning of next, should be seeing much less cases from this area. And all these splodges around here, different countries, like you look at Sweden, 156. But I think most of these are going to be from the Italy one. Some from Iran. Same with South America. They've got lots of connections with the 13 Ecuador. But the WHO are not so worried about South America. They're more concerned about Africa. So Algeria's got 17, Egypt's got 15. But these are still numbers they can control. And if you start getting, so this is the third line of defence really. So it's stopping getting it into Africa, and that's what we've really got to do. And if we can just delay it, and as I said, the more you delay it, the more therapeutics, the more closer to when we've got a vaccine. It's delaying deaths. People are not going to die, or not die so soon. And then, so if you started getting a big outbreak in Africa, once it starts getting to these sorts of numbers, like Iran's 5,000 or the 7,000 of South Korea, imagine that in the Congo, it's going to be quite difficult to contain it and keep it within Africa. However, with small numbers, then Africa is really quite, it's got quite a robust network because of all the fighting, for instance, Ebola in the Congo and in Uganda and places like that. For instance, Dr. Tedros, or I think it was one of them who was saying the other day that Nigeria has had 2 outbreaks of Ebola come into the country, and in both cases they got every single case and they didn't have any local transmission within Uganda. This shows excellent containment capabilities. So the countries in Africa, although they've got very weak healthcare systems in some ways, but they have a lot of experience in epidemics and containing things and contact tracing. They do contact tracing in Africa, and they do this containing in Africa. And if you talk about something Ebola, then everyone agrees that that's how you fix Ebola. You don't just let that just spread and spread and spread, and then try and protect the vulnerable. You contain it. Well, they're saying that this is a similar disease to that in the way it works. Nothing like as dangerous as Ebola, not deadly like that, but it's the same sort of thing. The contact tracing containment is what we can do with this. So if we can keep it out of Africa, then we will. That then is the third line of defence, and it's not the third line of defence just for Africa. It's the third line of defence for the entire world. Because if you had loads and loads of cases in Africa, then you'd have many more coming from there to around the world. You can't lock off Africa. You can't lock off Europe. The WHO say that boundaries by themselves just don't work. The virus finds its way through them. As people find sneaky ways to get past, however you try to stop them. And it actually makes it worse if you have very hard boundaries. Then people kind of smuggle their way through by boats, or they just disguise their tracks by saying, "Oh, I actually came from Russia." They flew from Africa to Russia, and then they claim that they were flying from Russia, or something like that. So that's the first line of defence, which is pretty much contained. That's our second line of defence, those two, and North America, and occasional splodges there. But and then I just want to say one other thing. If you are in any of these places, say you're in Mexico, and we've got 6 confirmed cases in Mexico. If you're in Mexico, bear in mind those 6 cases are all contained and quarantined. They're all quarantined, and all contacts will be quarantined, self-isolated. Just self-isolated, because quarantine is once you've got a disease in it. If they're just contacts and they don't know if they're diseased yet, so they're not really quarantined, but they're self-isolated and waiting to see if they get the disease, and if they've got the disease then they'll quarantine them. So unless someone has called on you and rang you up and said you've got to self-isolate your contact, then your risk is not increased at all by those extra 6 people or cases. It's only the contacts that have increased risk. Everyone else, then they might as well not be there because they're completely contained. And especially since I think those came from Italy, and so it's really just the Italian outbreak that's extended to Mexico. And it's the same for a lot of these. So we are the second line of defence, all of this, everyone. And then including little dots in Africa, they're the second line against the third thing is spreading in a big way in Africa. We've got to stop that for the whole world. So all of us are doing it. So Dr. Tedros is saying that every single country has to do this, not just for themselves, but for the rest of the world. So suppose the UK just said, we're not going to contain things anymore. Then we would rapidly get an increase in numbers of cases, and we can see from Italy how it would go. It would go very quickly up into thousands, tens of thousands. But you look at South Korea, and if they haven't contained it, we'd be up into the tens of thousands within a couple of weeks or something, and then eventually the hundreds of thousands, and we would be the big infection hotspot for the entire world. And we would have more cases than anywhere else in the world if we were to stop containing it. We would be worse than China. Could very easily, if we stop containing it, this thing spreads. It's got a doubling time of about 3 days. So 1,000, and then just to 2,000, to 4,000, to 8,000, to 16,000. That's 3, 6, 9, 12, 15 days, 2 weeks. You've got 1,000 to 16,000, I think, whatever it was. And then not very long after that, you're into tens of thousands, and then to the hundreds of thousands a few weeks later. So we absolutely, everyone has to stop it, and act to stop it for the entire world. So anyway, and one of the ways, and we can do that, it's not just the governments, it's you personally. And so I'm just going to give another short video about how you do it personally. You probably all know it, but I'll just double check in case anybody doesn't, about how you do it. So this is Aquinas, how you stop. Well, this is the quick thing. You wash your hands, use a tissue for coughs, and avoid touching your face. Those are 3 rules. And then this is how you've got to wash very carefully both the backs of your hands and around your fingernails. See, this is fluorescent dye to show where if it's not been washed yet, then you'll see washed properly, then it can get in around your nails. So make sure you wash your nails and the back of your hands properly, and do it for about 20 seconds. It's quite a long time. See, I've only done it for 5 seconds so far. It's quite a long time to wash for 20 seconds, but that's what you've got to do. And so do that several times during the day. Anyway, I'll talk about that in a minute. So, this is for Doomsday Debunked on Facebook, and to help people who are scared of various things. And so, do join our group if you want to help some of the scared people, and or if you're scared yourself and need reassurance, and if you're good at fact-checking, and please, we have especially interest in people who go to reliable sources. In this particular case, then the WHO, I would say, are the top in terms of reliability. And these sensationalist stories, they're always running stories by these epidemiologists. And for weeks, these epidemiologists have been saying that within a few weeks, we're going to have millions of cases. or hundreds of thousands of cases, tens of thousands, hundreds of thousands, then soon millions. It's just not happening like that. It is just not happening the way they predicted. And they're continuing to predict that it's going to very quickly increase to millions of cases. And they just can't seem to believe that the data is going against what they expect from the experience with influenza. So they just keep coming up with these new predictions which are not taking account of containment, or they may do it with, we're not making various assumptions about how it spreads that don't match what happened in China, and that don't match what happened in South Korea, and they assume that nobody's doing anything to contain it or to break it up, prevent it spreading, and then they say there are going to be 100,000 a million people. We can definitely stop it, and that is what the people I regard as the top experts in the field are saying. We can definitely stop it. And don't worry if you've got 1,000 people, if you've got 10,000 people, it's the story behind the numbers that matter. If you've got 10,000 people and they are being detected within 3 days of getting symptoms, and they're being immediately quarantined, and all their close contacts are followed up and self-isolated, and even if you've got 10,000 people in your country with the virus, it is going to very quickly go down to less cases every day until eventually it's gone in your country. And within a few weeks, and it'll be getting less and less, and then within a month or two it's completely gone. That's just the way the maths works. Anyway, maybe see some of you on Doomsday Debunked on Facebook, and do be sure to read the rules at the head of the group and before you post there, if you want to take part. Thanks, and do subscribe if you want to see more videos like this.